Gateway to Global Aging Data, and we will be providing an introduction to the Health and Retirement Study, a panel study produced by the University of Michigan, and two complementary user-friendly data files constructed by the RAND Corporation and the Gateway to Global Aging Data. I am Jenny Wilkins, and I will be going over the first part of our presentation, and my colleague, Tristan Phillips, will be going over an example in the second half of the webinar. The webinar should last about 45 minutes with time for questions at the end, but you're also welcome to ask questions as we go, which you can do using the question and answer panel or the chat box. For this webinar, we are planning to provide some background on the HRS and briefly go over the various types of data you can download from the HRS. Then we'll go over the international network of studies that have developed following the HRS's lead. We'll show you some of the tools the Gateway offers in support of your study of the HRS and these other studies. And finally, provide an example of how to use the HRS data. The HRS sample is a nationally representative sample of the population aged 51 years and older living in private households in the United States. This means that it originally excluded individuals who were living in a nursing home or other institutions. The HRS was designed to provide panel data that enables research and analysis in support of policies on retirement, health insurance, saving, and economic well-being. The survey elicits information about demographics, income, assets, health, cognition, family structure and connections, healthcare use and costs, housing, job status and history, expectations, and insurance. In selecting their sample, the HRS used a multi-stage probability design with 4 selection stages. The sample includes a single age-eligible individual within the selected household and their spouse or partner, regardless of age. But it does not include other age-eligible household members, as some other studies do. The HRS sample updates to include new spouses or partners after the baseline sample, and will follow respondents into institutions as time goes on. The HRS also oversamples 3 groups, specifically Black and Hispanic respondents and respondents living in Florida. As of the 2020 interview year, the HRS has had 7 distinct cohorts that have been incorporated into the sampling framework. The first was the HRS cohort, with individuals born between 1931 and 1941, who were first interviewed in 1992 and every 2 years following. The second was the AHEAD cohort, or the Asset and Health Dynamics Among the Oldest Old, which captured those born before 1924. The AHEAD cohort was first interviewed in 1993 with a follow-up in 1995. Starting in 1998, the HRS and AHEAD cohorts merged and have been interviewed every even year since. Then in 1998, the Child of Depression cohort was added, which included respondents born between 1924 and 1930. The War Baby cohort brought newly age-eligible individuals in 1998 and was followed by the additions of the Early Baby Boomer cohort in 2004, the Mid-Baby Boomer cohort in 2010, and the Late Baby Boomer cohort in 2016. The HRS will also be adding their 8th cohort, Early Generation X, in 2022. Here we can see when those interviews occurred over time for the first 14 waves. You can also see that the HRS has been able to maintain a sample of roughly 20,000 respondents over the years, and you can get a sense of the percentages of each cohort that have stayed in the study over this long period of time. In addition to the core interview, which is what we call the main interview, the HRS has also collected a great deal of other information. The HRS regularly collects information from leave-behind questionnaires, most frequently the Consumption and Activities Mail Survey, called CAMS, and psychosocial questionnaires. But they've also covered some more specialty topics with these self-completion surveys. With in-person interviews, the HRS has also collected some physical measurements, including several that are collected by other HRS family studies, like blood pressure, lung function, grip strength, balance tests, timed walk, and height, weight, and waist measurements. The HRS has also recently started conducting hearing tests, as well as collecting saliva and dried blood spots for DNA and other biomarkers. Starting in wave 2 of both the HRS and AHEAD cohorts, the HRS began collecting exit interviews for deceased study participants. These focus on information from the end of life and the period between the respondent's death and their last core interview. In cases where certain aspects of the respondent's estate haven't been settled by the time of the first exit interview, the HRS will actually go back and conduct post-exit interviews and post-exit interviews in select cases to gather that information at a later time. The HRS has also collected life history data through mail surveys in 2015 and 2017. Life history interviews generally collect retrospective information on a person's life, including their marital, children, work, and health history since childhood. In most cases, HRS enrollment interviews are conducted face-to-face. From 1994 to 2004, most follow-up interviews were conducted by telephone. Since 2006, the HRS has alternated between half of the respondents completing an enhanced face-to-face interview with a health assessment, biomarker sampling, and psychosocial survey, while the other half completes the core interview by phone. These half samples alternate waves so that there's a full enhanced interview for each respondent every 4 years. If you'd like to find out more about the Health and Retirement Study, please see their cohort profile from the International Journal of Epidemiology. So let's first get into the types of data released by the HRS. The HRS interview questionnaire is divided into different sections based on subject matter. After the HRS has collected and cleaned the data, each section of data is released individually. For the 2018 wave, there are 40 individual sections of data released by the HRS team, which are divided into respondent-level files in which the answers apply to each respondent, and household-level files in which the answers apply to both the respondent and their spouse or partner if they have one. Both respondent and household files are released in a wide format where there is one row for each respondent and a ton of columns representing each survey question. Lastly, there are what I'll call other person files. So these files correspond to people outside of the respondent, for example, other household members or caregivers. These files are released in a long format, generally, where they can be multiple rows for the respondent, corresponding to the number of people who are being asked about. So if there are 3 other people in the household, then there will be 3 rows using the respondent's HHID, one for each extra person in the household. All of these individual files are organized by year or wave and are available under the public survey data of the HRS data products. The RAND Center for the Study of Aging then merges the respondent and household level files of a given wave together and releases this merged file as the RAND HRS FAT file. One thing you'll want to notice is that the household ID is HHID and is present in the respondent, household, and other person files. The person identifier is PN, or person number, which is available in the respondent files. Each person's unique identifier is created by combining the HHID and PN. So RAND goes the extra step of combining these to create HHID PN so that only one identifier is needed. The next type of data is harmonized data. I'll explain harmonized data in a little more detail later, but basically it takes a subset of the original survey data and creates new research-ready variables that are defined as similarly as possible across waves. There are 2 main harmonized data sets for the HRS. The first is the RAND HRS Longitudinal file, which is created by RAND and was the first harmonized data set for the HRS. It is generally considered the main harmonized data set for the HRS and contains a large number of variables that you might find useful. The Harmonized HRS has been created by our programmers here at the Gateway to Global Aging Data. It was created to supplement the RAND HRS and to include variables that the RAND HRS Longitudinal file didn't already include. Both of these files are longitudinal and contain data from waves 1 through 14 right now, and both are set up as wide files, meaning that there is one row for every respondent. As you can gather from the graphic, neither one contains all of the available data from the HRS survey, and they are intended to not have overlapping content areas. But between the two, they cover a great deal of information that the HRS has collected. To give you a little detail into the differences between the RAND HRS longitudinal file and the Harmonized HRS, I've provided a general breakdown of what's available across the two datasets. While the RAND HRS provides most of the core interview and demographic variables, the Harmonized HRS adds the self-completion and physical measures indicators and some other helpful variables for cross-country analysis. In health, the RAND HRS has ADL and IADL difficulty indicators and some summaries, major disease diagnosis indicators, and health behaviors, while the Harmonized HRS created additional summaries, incorporated more disease diagnoses, and provided the age diagnosed and medication usage for diseases, along with information on vision, hearing, sleep, and pain. We did just get a question in the chat box, and yes, this recording will be available for attendees to view later and in PDF format. So there are numerous subjects where variables are only available from the RAND HRS longitudinal file, and others where the Harmonized HRS has made some additional variables available. Despite the intention of having non-overlapping content areas, there are now a few places where there is some duplication of content, including in some of the physical measures data. But there are several main areas where the Gateway team has significantly expanded harmonized datasets in close collaboration with topical experts, namely physical measures, caregiving, stress and psychosocial measures, and childhood health and economic indicators. Similar to the core data, there have also been efforts to harmonize data related to the end of life. The Gateway has created the Harmonized HRS End of Life, which is released as a separate data product that only includes individuals who have a completed exit interview. And then RAND incorporated some variables from the exit interview into the RAND HRS longitudinal file as well. Both sets of variables include data from waves 2 through 14 of the exit interview, while the Harmonized HRS End of Life also incorporates some information from the post-exit and post-exit interviews for some variables also. There's more overlap in content areas between these groups of harmonized variables than there is for the core interview. For example, both the RAND HRS longitudinal file and the Harmonized HRS End of Life provide some basic demographic and healthcare utilization information, while the Harmonized HRS EOL also incorporates some additional measures. We see more of the same with these subjects, where there are some areas of overlap and several additional variables and subjects available in the Harmonized HRS End of Life. Because of the remarkable success of the HRS, there have been studies developed in 47 countries around the world intended to be comparable to the Health and Retirement Study. We tend to call this the HRS International Network of Studies, or the HRS Family of Studies. And this network continues to grow and expand to even more countries, providing an incredible opportunity for cross-country research. What sets the International HRS Network of Studies apart from many other surveys is that they are built to be representative of the country's population of older adults. They are longitudinal, meaning they follow the same people over time, and they are multidisciplinary. While many surveys will focus on a single content area like economics or health, these surveys cover not only health and economics, but also family dynamics, psychosocial measures, and so much more, including the integration of biomarkers through physical measurements and DNA collection. These studies have also worked to coordinate their survey instruments and to enhance the quality of their economic data. Importantly, they all release publicly available data that is open to researchers around the world for free. From the chart, you can begin to see the other countries and studies that have developed following the HRS, from Mexico to many countries in Europe and Japan, South Korea, and China, among others. Many of which have collected data for more than a decade, though none come close to the length of the HRS follow-up. For 11 of these surveys, covering 38 countries, the Gateway provides harmonized data for free. As I briefly explained before, harmonized datasets are created to provide research-ready variables that are defined to be as comparable as possible across waves and studies. One harmonized dataset is created for the data for each study. They are longitudinal and incorporate all available waves and are set up so that each individual is one record or row. Variables are built with an intuitive naming convention. For example, R14 left out indicates how often the respondent reported in wave 14 feeling left out, which is part of our loneliness measures. We also create spouse versions of most variables, so you could study how something impacts both members of a couple. While ideally every variable is comparable over time or across studies, there are instances in which question wording or cultural differences render measures similar but not strictly comparable, in which case we'll provide a study-specific variable name using an underscore and the first letter of the study. For example, R9 G care sick D underscore H indicates the frequency of caring for a sick or disabled adult in wave 9 of the HRS, but it uses a different frequency scale than some of the other studies do. Finally, harmonized variables have been built to account for any survey skip pattern. Here's a pretty simple example of accounting for survey skip patterns to create a harmonized variable. We want to create R1 smoke ev, which indicates whether the respondent has ever smoked in wave 1, with a 0 meaning the respondent has never smoked, and a 1 meaning the respondent has ever smoked. The HRS first asks whether the respondent has ever smoked, and if so, then asks whether they smoke now, while ELSI, which is a comparable study in Brazil, first asks if they currently smoke, and if not, then if they've ever smoked. We account for these differences when we create R1 smoke ev and all of our other and even more complicated harmonized variables. Along with each harmonized dataset we create, we also provide an accompanying codebook. We provide a brief introduction to the harmonization project and study, go over survey timing, design, and sampling, provide some basic information on weighting and on any imputations, and divide variables into sections based on research domain. We also provide specifics of the harmonization process, including some descriptive statistics, the categorical variable codes, if applicable, how the variable was constructed, and we detail any differences across waves or any differences compared to the RAND HRS or Harmonized HRS version of the variable. While the Gateway creates the Harmonized HRS as the complement to the RAND HRS longitudinal file, we also create datasets that are comparable to the combination of the two. And these are done for Mexico, England, Europe, Costa Rica, South Korea, Japan, Ireland, China, India, and Malaysia. Several of these harmonized datasets will have an update released soon that includes recently available waves of data. We will also be working on creating harmonized datasets for more studies, particularly in South America. We have also been building comparable harmonized end-of-life data files for these studies. We will be releasing an update to the HRS version soon, and have also created harmonized datasets for Mexico, England, Europe, and South Korea, and we'll be releasing data for the Japanese and Chinese studies for the first time very soon. In some cases, the harmonized datasets are distributed directly through the Gateway at g2aging.org, but in most cases, they are distributed through the originating study, as is the case with the HRS. For a couple of studies, the harmonized data sets have to be created using Stata based on a code provided by the gateway. There are a number of resources that the gateway provides to enable your research using the HRS or another study within the network. So I'm going to go ahead and switch over to the gateway and highlight a couple of these. So this is g2aging.org. If you select Surveys at a Glance, you're immediately met with a study overview table. This provides some basic information about these surveys. But if you select HRS, it will take you to the HRS study overview, which provides much of the same information that you've already heard in this webinar. You can also browse the study overviews for some of the other HRS family studies as well. You can also look at the questionnaires or survey metadata available for each wave of each study, whether that's the core interview, end of life, life history, or one of the health assessments or self-completion surveys. If you select one of these, you can go into the actual survey questions. Most questionnaires are broken up into modules, so if we select C, physical health, we can see the start of these questions. So you can view them in this kind of list, or you could use a flow chart, which makes it a little easier to follow skip patterns. Or you can look at it in a more traditional codebook view, where you show the question and answer options. You can also search any of the questionnaires using a keyword. I'll go ahead and search for lonely and limit the results to the HRS. So as you can see, there are questions related to loneliness for every year of the HRS since 1992. If you select the concordance tab, then you can see our current concordance tables. I'll go ahead and select loneliness under stress and psychosocial content. You can see that these detail question availability across surveys and waves. We also offer interactive graphs and tables where you can select the country and topic that you're interested in from our harmonized data sets. You can even contrast it with contextual data or look at it by subpopulation. We also offer an ability to search publications based on the HRS family of surveys, which can sometimes be hard to limit using other search sites. Lastly, our downloads page provides links for downloading the survey data and harmonized data sets. We provide data access instructions and copies of our codebooks. If, for example, you select on Harmonized HRS, it will take you to the HRS contributed projects where you can download the Harmonized HRS and Harmonized HRS end of life. Now I'll have my colleague Tristan take over and present the example analysis.
Thanks, Jenny. That was great. And maybe I'll just take this. We have 3 questions, so I just want to address those, and Jenny, feel free to chime in. So the first one was, what tool does the gateway use to review, compare, and document the similarities across the HRS and HRS related studies? Probably, Jenny, do you want to answer that? I think you covered a lot of that already, but maybe just reiterate.
Yeah, so we actually create many of the tools that we use to compare across studies. And that involves looking very deeply into all of the HRS family questionnaires. So we have created some concordance tables, which goes over the differences in question availability across surveys and waves. And then we're also going to be introducing a tool that will show the differences between harmonized variable availability, and that should be pushed out on our website at some point this year.
That's
Kristen,
great.
did you want to add to that?
No, that's perfect. I would also, I'll just bring up just so people can see. There we go. So the concordance across surveys are here on the gateway, and then, for instance, you could see how cognition questions differed by survey. So this is all kind of work that our team does. We really take a lot of time to get a sense of whether their questions were asked and how they're comparable. And then we document in our code books, as Ginny showed, any kind of assumptions that we make in there. So when we're using the variables, it's really good to be aware of those study differences. So it's a good question. The next question was, how is age harmonized across studies? Some have cohorts 51 years old and others 45 and up. And yes, that is a very good point. You can see here in this study overview, we have this age eligibility, and they can be quite different. Mars, the Malaysian study, starts at age 40. The JSTAR study actually was 50 to 75. It was kind of banded on both sides. So these are the samples that the studies have chosen for themselves. I think when doing comparative cross-study, cross-national research, it's important just to remember to always reflect on what the sample was. I mean, something that we often do in our research is that, let's say, for instance, where we want to compare like Charles, the Chinese study, with HRS, the United States study, we might limit the Charles study to just refer to those people who would be age eligible for the HRS as a way to make that data, make those individuals a little more comparable across countries. One of the reasons that they have these different ages, though, is that aging is it's an individual process, but it's also very contextual in people's environment. So for the Indian study and the Chinese study and the Malaysian study, the South Korean study, I think they deemed that there were important parts of this aging process that were happening at early ages that are in the US. So I think you just have to be in your research quite thoughtful about thinking through that decision. There was another question also about how to get access to restricted data. So lots of the studies do have restricted data. One of the things that we've done on the study overview tabs is we have this data access tab here. And it can give you more information about getting access to restricted data. So some of these data, for instance, like the genetic data, that is restricted data, but it's available on the University of Michigan. You get approved by the University of Michigan. There are some other types of restricted data which you have to go to some other places to apply for. So by study, I think we've tried to give you an idea of, ELSA also has quite a bit of restricted data of where you get access to these data, whether it's on their kind of main data download site or somewhere else. But it's a good question.
I'll just briefly add that there's usually a little more work on your part to gain access to that restricted data, like more paperwork to fill out describing how you want to use it, which is not always required for the less restricted data.
Yes, that's a very good point. Yes, some of the requirements of the restricted data can be quite high. For instance, like having a federal grant to be able to study it. So sometimes those aren't available to individual students, but it will just depend on how that study has decided to grant access to that data. Finally, the last question we'll take, and then we'll move over to the analysis section, was, do you use Excel or what kind of software for the concordance, those concordance tables I showed? So yes, these are available in Excel if you wanted to download it. You could just download it here at the top right. It is quite a lot of variables. This is, we have a lot of plans to change. And one thing that we want to do for this in the coming year is kind of change these to really just show just the variables you're interested in, because it's quite a bit of information for quite a lot of studies on this page. But if you wanted to limit it yourself, you could just download an Excel format and then hide or delete those rows you're not interested in. So you get a slightly more concise picture of the studies and measures you're looking at. All right. So let me get started. So what we're going to do now is a little bit of an example analysis because I want to illustrate exactly how to utilize these different data sets. As Ginny mentioned, there's original HRS data, there's RAND HRS data, there's harmonized HRS data. And so I want to kind of give you an example that combines from those different sources in a way that's quite common for research. For me, myself, often seeing kind of research be done or seeing a colleague do it is quite helpful for thinking about what are the steps I need to take to go through it. For this example, we're going to utilize Stata, but the HRS data are also distributed in SAS and SPSS, and you can use them in a variety of statistical packages and languages, including R, which I know is quite popular. So even though I'll be using Stata for this example, I think the steps that we'll go through will be quite similar, regardless of the statistical package that you're using. So to structure our analysis, I'm going to introduce a research question, and we're going to work to answer this question using the HRS data. So our research question is going to be whether providing caregiving is associated with lower life satisfaction. I think many people think about the older populations, and in this case, the HRS sample population, as people who will require care. But one thing that we know is also that the responsibility of caregiving is shouldered quite frequently by the spouse of the person who's requiring care. And so since the HRS is a sample of couples, where at least one couple is at 51 or 51 or older, it's also a great sample to consider caregiving. So you can study both caregiving and care providing as part of the HRS. For this analysis, we're going to look at individuals who provide care, and we're going to consider whether this caregiving that they're providing, the fact that they're providing this caregiving is associated with lower life satisfaction compared to people who don't provide care. And first, just simplicity of this example, we're going to be doing this just one cross-sectional analysis looking at one wave of the HRS data. So the steps that we're going to do, and I think that these will broadly be true for most research projects, is we'll have four main steps for our analysis. First, we're going to identify the relevant variables we need to use for our analysis, and we can determine which data set we'll find them in. Second, we'll create an analysis data set with variables from multiple types of HRS data sources. Third, because some of the data files we're using are longitudinal, and we'll only be considering one wave for this analysis, we can drop any observations who didn't participate at that one wave. And at that step, we can also think about our survey design and the analysis weights provided by the HRS. And lastly, now that we have our data set and we've thought through how to generate population estimates using those design and weight variables, we can begin some simple research analysis to help answer our question. Let's start by thinking of the variables we'll need for this analysis. Let's utilize wave 12 of the HRS, which was mainly conducted in 2014. For any analysis we do, we're going to want to make sure we have the right identifiers for merging the different data sets. We'll also want to make sure that we have variables which capture the HRS sample design and will allow us to generate population estimates. Now that we have those kind of initial variables, we can also think about our particular analysis. We're going to need an indicator of whether the respondent provided caregiving, as well as a measure of the respondent's life satisfaction. To further our analysis, we might also want to consider including some other secondary measures, which we think might be affected by caregiving and would also affect satisfaction with life. And these could help us explain what might be driving any relationship that we observe. Lastly, we'll make sure to include some basic demographic variables that we might want to control for during our analysis. To locate these variables, you could either use the HRS website or the gateway. The HRS website has some great functionality also with a concordance search and being able to look through the questionnaires themselves. One advantage of the gateway is that you can search either the HRS survey questions or the harmonized data sets like the RAND HRS and harmonized HRS data files. And this can be a helpful tool for determining where to find the variables you will need for your analysis. So I'm going to just jump back to the gateway. And if we go to surveys at a glance, you can see that we have this keyword search up here. And let's just start. We're going to be using mainly harmonized data sets. So I'm going to select subtopics. And we're going to look, let's see, we want a person identifier, and let's get an age at interview and gender. And in this case, we're going to be using the RAND HRS and Harmonized HRS. And as I mentioned, we're going to be looking at the wave that was conducted mostly in 2014. So if I search for those inside of Harmonized Data, you can see how I can find some of those in RAND HRS or Harmonized HRS. Here we have our identifiers. These are the ones that Ginny identified. So we have PN, HHID PN. We have that household identifier also. We can also see that the RAND HRS has a couple different age variables. So they have age in months at the beginning of the interview. They also have age in years at the beginning of the interview. And then they have age in months at the end of the interview. If you're wanting to think through like which of these is the variable I would want to use, I think the code books are, once you've identified that variable name, the code books are a great place to go to find out a little more information. You can see here, if we click on Harmonized HRS, we have just those identifiers. But in RAND HRS, we'll have the, we also should have a gender variable. Just a little further down, we have a lot, there it is, RA gender. So which we can see here is coded as 1 for males and 2 for females. Okay, so starting with the RAND HRS longitudinal file, we can pull in the respondent identifiers as well as the HRS clustering and stratification variables. And Jenny kind of mentioned this difference, but depending on what file you need, the identifiers might be different. So kind of the primary identifier in the RAND HRS longitudinal file and the Harmonized HRS file is HHIDPN. But if you're using the original HRS data, as we're doing here, you want to use HHID and PN kind of together. You're going to use them jointly to identify respondent level observations. We can also pull in some basic demographic factors. We want to control for gender and the time at interview. I think those kind of make sense as 2 basic demographic factors for our analysis. And lastly, we'll pull in the respondent cluster identification and the respondent stratum identification. So this is going to give us some information about how the HRS was sampled and why this might be important. And we'll talk a little bit more about that also when we get to that step of actually producing those estimates, which is just for this kind of complex sample design that the HRS uses. For this analysis, most of the kind of important analysis variables we'll be using will be from the Harmonized HRS dataset, which specifically includes variables on caregiving and psychosocial measures. The Harmonized HRS also includes some important variables to identify our sample and weight our analysis. Questions on whether providing care to a sick or disabled adult were asked as part of the HRS Leave Behind questionnaire, which was only given to half of the full HRS sample each wave. The Harmonized HRS includes an indicator of who completed the Wave 12 Leave Behind questionnaire and includes a weight that was designed by the HRS team specifically for generating population estimates using measures based on responses from this Leave Behind questionnaire. Using the Harmonized HRS codebook, we could find out more about the caregiving indicator and the satisfaction with life scale, which were asked as part of that Wave 12 Leave Behind questionnaire. I'll briefly just jump over so you can actually see our codebook here. And on the left here, we have some bookmarks because it's quite a long file. It's I think 1,500 pages, I think. It's distributed as a PDF, and that's available on our downloads page. But for instance, if we went into assistance and caregiving, we can see this is the variable we're going to be using, which is care for sick or disabled adult. So you can see we have a binary indicator. We also have a frequency variable. And then we have a lot of text about exactly how they were asked. And this is where, if I was doing my research, I would kind of find out that this was asked as part of the Leave Behind survey. So that's only asked to half the sample. And you can see in our value codes here that this is the portion of the sample who we don't have any values for them because they didn't answer the leave behind survey there. We called those .L. So these codebooks are incredibly helpful, and I would really encourage you to use them. We also point to differences that might have happened in question wording or who was asked this question over time inside of the HRS. And I mentioned that we might also want to include some secondary measures in our analysis, which might be affected by caregiving and would also affect satisfaction with life. Since we know that the main variable we're using in our analysis are from the Wave 12 Leave Behind questionnaire, we could also look in this questionnaire to see if there are other measures of interest that we could use. And we can do that using the Gateway Survey at a Glance tab. So let's jump back to the Gateway here, and we'll go back to Surveys at a Glance. And we looked at the Study Overview tab before, but we could also go to the self-completion questionnaire. So these, and you can see for HRS, we have those self-completion questions, and we're using Wave 12. So we could look at the HRS Wave 12 self-completion questionnaire. And here we can see all the other questions that are asked. So for instance, maybe we would think that how often someone prays is quite important to the to this kind of puzzle that we're trying to pick out, or things we want to control for in our analysis. The variables that we're actually going to use are going to be two variables about control. So here we have a HRS question, which asks, using a scale from 0 to 10, where 0 means no control at all, and 10 means very much control, how would you rate the amount of control over your social life these days? So I could imagine that someone being responsible to care for someone could also lead to kind of a loss of control over social matters. So this kind of seems important. And I would assume that loss of control could also impact people's feeling of overall life satisfaction. So I think this could be an important variable to include, and we'll also use the second one, which is a really similar question. It's structured similarly with the same scale, and it's control over financial situations. I think caregiving often has financial implications for a family, so we're going to exploit this variable there also. So these are two questions which haven't, from the HRS, which haven't yet been incorporated into either the RAND HRS longitudinal file or the Harmonized HRS. And as Jenny mentioned, there's many parts of the HRS survey which might be of particular interest to your research, but they aren't going to be in either of these data sets. So in that case, you're going to want to go back to the original files from the HRS, and you're going to want to download the HRS Wave 12 survey data files, and you can find these two variables. So now we're ready to start creating our analysis data set. We'll start off by loading the RAND HRS longitudinal file data into our data session. Both the RAND HRS longitudinal file and Harmonized HRS data are longitudinal data files that contain any individual who completed an HRS core survey between HRS Wave 1 to HRS Wave 14, and that includes Wave 12. They also both contain a lot of variables. So the RAND HRS longitudinal file has about 14,000 variables, and the Harmonized HRS has about 13,000 variables. And because these data sets are quite large, it can be helpful to only pull into Stata those variables which we'll actually be using for analysis. So in Stata, we can do this by specifying the variables we want to use exactly from that data set. So you can see here in our use command, the first thing we do is we say use, and then we list those variables that we identified are going to be important to pull from this RAND HRS data set. And I'm going to switch over to Stata here, and we'll kind of walk through these steps. We'll also make this data code available after this webinar on the documentation page, as I mentioned in the chat earlier. So if you wanted to see this code or replicate it or just look over it once more, we'll have this code available. And we also on there have some kind of similar SAS code for doing similar tasks, if you're more comfortable with SAS than Stata. So what you can see is here we've loaded our variables. We could see here in the variable panel, we've just loaded just those variables we specified. So we don't have all of them. But if we do a count measure here, you can see we do have a lot of people, right? So 42,000 observations. And so that's anyone who responded to an HRS core interview waves 1 through 14. We're not going to use all these people for our analysis, but because they're just part of the these longitudinal files, they're going to be inside of inside of our kind of Stata memory, working memory for right now. So now that the RAND HRS longitudinal file data is loaded in Stata, we can merge in the Harmonized HRS. The RAND HRS longitudinal file and the Harmonized HRS both cover exactly the same respondents. So this merge will not introduce any new observations, but only add the variables we need from the Harmonized HRS dataset. Both the RAND HRS longitudinal data file and the Harmonized HRS are the respondent. They both use HHIDPN as their primary identifier, so we can perform a one-to-one merge in Stata, where Stata knows that for every one observation in the RAND HRS longitudinal file will match to another one observation in the Harmonized HRS file. Similarly, as when we loaded the RAND HRS longitudinal file, we can choose to only pull in the variables from our Harmonized HRS, which we're going to use for our analysis. And you can do this in Stata using the keep using option. And if we jump back to our Stata window, we can see this merge, and we can see that we get everyone is matched, right? So for all 42,233 people, those observations are identical between the RAND HRS longitudinal file and the Harmonized HRS, but the variables are different. So we're bringing in new variables. If we look here at our variable pane, we can see these additional variables that we brought in from the Harmonized HRS. They're going to be really important for our analysis. And lastly, we want to put together our analysis. To put together our analysis, we're going to bring in the two variables from the HRS Wave 12 Leave Behind questionnaire data. This is also a respondent level file, but respondents are going to be identified jointly using the two identifiers, HHID and PN. And if you remember, we brought those variables in from the RAND HRS longitudinal file. One difference is that Stata is variable names are case specific, and they are lowercase variables in the RAND HRS longitudinal file, but in some of the HRS data, they are all uppercase. So we need to just rename them to make sure that we can match them. And then we're going to perform a one-to-one merge jointly. And let's show that inside of Stata. So you can see that we were able to merge. And if we look at our variables window, we've got our two extra variables here. So control over social life and control over financial situation. You'll also notice that there was one individual who was inside of that HRS Wave 12 Leave Behind questionnaire. And that person wasn't in the RAND HRS or Harmonized HRS longitudinal files. And that's most likely because that respondent completed the Leave Behind questionnaire, but they never completed a core interview, so they're not included in there. So for the sake of this analysis, I'm just going to drop this individual because we're not going to have the other kind of information like their age or their gender or a weight value for them to be able to really include them in our analysis. So we're going to drop them. And then we should have, if we look here, we're still going to have our 42,233 individuals. So we've now got all our data sets loaded. The next step is we're going to actually limit that data a little bit. Because we have so many individuals across all of the waves, and we're only going to be looking at people who were a part of Wave 12. And actually, not even all the people who were just part of Wave 12, but people who were part of the Wave 12 self-completion questionnaire, so that's only half of the full Wave 12 sample. So we're only going to keep those individuals because that's where we're getting kind of these important variables that we're using for this analysis. And we can do this using a harmonized HRS variable called INW12SC that identifies whether or not someone was in that Wave 12. If we look inside of Stata, we could just have that variable. We can see that out of the full sample, that we have 7,541 people who were part of it. And then these are people who were just part of wave 12, and then 11,206 who did not, either they weren't part of that sample or they didn't send back in their survey, this self-completion survey that we're using. So we can drop those individuals. Let's do that. And now we can see if we count, we've only got that 7,541 in observation. So that's great. So we really just limited our data set. This is helpful also, if you want to save your analysis data set, you've got your identifiers in, you can always merge back with other, the larger data set. But for this analysis, we'll just keep it quite small. And now we can talk about dealing with survey design and weighting. So the HRS uses a multi-stage area probability sample design. And because of this, we must account for the geographical stratification and clustering in the estimation of standard errors. And even though the HRS is a nationally representative sample of individuals over the age of 50 in the United States, the HRS, as Jenny mentioned, includes an oversample of African-American and Hispanic households. And they do that for a great reason, which is to support research on racial and ethnic disparities. But because of this, and also to account for any non-response bias, they provide analysis weights. And these analysis weights are essential for generating population estimates, which we can infer to the HRS target population of the United States population over the age of 50. How you deal with these sample design and weighting variables is going to differ based on which statistical package you're using. Stata includes a helpful set of tools specifically built for dealing with complex survey data analysis. And you can see here that we can actually tell Stata all the specifications of the sampling design and the weights we'd like to use in a single command. And Stata will recall that information in all the commands which follows, which allows us to have slightly kind of cleaner looking code. So here we're specifying what's the stratification and the clustering variable, as well as the weight that we want to use to produce these estimates. So we know that the point estimates we get are going to be representative of the US population, older than age 50. And we also know that our sample errors, our standard errors that we generate from that estimate can be trusted a little better because they've kind of already been adjusted for this complex survey design using clustering that the HRS uses that can kind of lead to kind of standard errors which are too small. And if we go through this, you can see exactly how we've defined our sample here, our survey data. All right, so we've got our data loaded. We've only kept those individuals that we're using for this analysis, and we've told Stata about our complex survey design and weighting. So now we can actually start, right? So everything else we've done so far is kind of just set up. So let's look at our satisfaction with life scale, those scores for anyone who completed the HRS Wave 12 Leave Behind questionnaire. And in Stata, we can do this using the SBY prefix command, which is an indication for Stata to remember the design and weighting specification we previously entered with SBY set. So the satisfaction with life scale is a continuous value ranging from 1 to 7. And we can estimate the mean score for the whole sample. So let's just jump in and let's do that in Stata. So we can see that for the HRS target population of individuals over the age of 50 living in the United States, we would estimate the average life satisfaction with life scale score would be a 4.9 of 8, and that's out of a possible 7 points. So that's kind of overall. And then now we're going to look particularly at caregiving. So it's really simple also inside of Stata to start to look over multiple groups separately. So we're just going to add the over option to our previous command and specify that we want to estimate the mean over the two groups identified by our caregiving variable, which is R12, gave care to a sick person. So let's look at that inside of Stata. You can see we get kind of really clean code here. So you can see that we estimate the satisfaction with life scale score for people who were not providing care to be 5.03, but it's 4.79 for people who are providing care. And we can also look at that graphically which is sometimes nice. And let's remember that higher scores on this satisfaction with life scale indicate more satisfaction. So it appears that people who are providing care have less life satisfaction than people who are not providing care. And looking at this graph, which I've included some confidence intervals here, it looks like that difference is statistically significantly different. But we can actually compare that using Stata also. And we can do that using a post-estimation command inside of Stata. And what this allows us to do is it's kind of test whether those two estimates are statistically significantly different. So inside of Stata, we're going to go through that next step. And what we can see looking at this probability greater than the F statistic in the results is that these two estimates are statistically significantly different with more than 99% confidence. We can say that. So that means we are really seeing something that's different by these two groups. In the next step, let's look at the relationship between that satisfaction with life scale score and one of the secondary factors we brought in, control over social life. We want to check to see whether indeed do we see a significant relationship between life satisfaction level and level of control over social life. If you remember, control over social life was asked using a 0 to 10 point scale, where higher numbers indicate higher levels of control. And because we want to look at the relationship of these two variables, and both variables are continuous values on a scale. So instead of estimating a mean for different groups, we can perform a linear regression, testing the correlation between the values of these two scales. And we're going to do that again in Stata using that SVY prefix command. We can see here, once we've got our regression results, we can see that indeed we estimate that higher values of social control score are associated with higher levels of life satisfaction. So our coefficient here is positive. It's a little hard to judge the size, but it doesn't seem that small. And you can see that the probability that is significant is very high. Next, we're going to do this exact same thing with our second secondary factor, the control over financial situations. This code is going to look exactly the same. And if we look at those results in Stata, we can also see that higher values on the financial control scale score are associated with higher levels of life satisfaction. Finally, kind of wrapping this up, let's move to a multivariate analysis. So we're going to start to control for some basic demographic variables, which might perhaps be associated with caregiving and life satisfaction. For instance, maybe we think it's possible that it's more likely that women provide care than men. And it could also be possible that maybe women on average just report lower levels of life satisfaction. So we might want to control for that gender dynamic here. We can do that using a multivariate linear regression. And again, just all we have to do is employ that SVY prefix command. So let's look at our results inside of Stata. So we can see that we do not estimate that gender is associated with different life satisfaction levels. If you look here on this coefficient, it looks a little bit small here on female and it's insignificant. But we do estimate a small but mildly positive relationship here between age and life satisfaction, suggesting that people at older ages have higher life satisfaction. But even while controlling for those two demographic factors, we still see a large, significant, and negative association between caregiving, people who provide care, and having lower levels of life satisfaction. So in our last step, we're just going to bring in piece by piece our two secondary values. So in this first one, we're just going to add to that basic, that multivariate linear regression. We're going to add to, in addition to our demographic variables, we're going to add that control over social life. That would be the first step. Looking at our results, we can see that while we estimate the relationship between social control and life satisfaction are large, they seem to be large, they seem to be significant, they're positive. We still see kind of a relatively large negative and significant correlation. And when we add in our second secondary value or secondary factor, we still see that kind of large, significant, and negative coefficient on determining life on life satisfaction for those who are providing care. So our basic analysis today has suggested that people who are providing care have lower levels of life satisfaction, even when controlling for basic demographic factors and accounting for some secondary factors. There are a lot of ways we could expand this analysis further, including accounting for additional factors, which might explain that relationship better. We could also move from a cross-sectional analysis to a longitudinal analysis. This is one of the real powers of the HRS. So one thing we could do is we could actually observe people over time who start caregiving and look at the effect on their life satisfaction kind of before and after caregiving. This is one of the things that makes the HRS study very powerful. The HRS is an amazing resource for understanding the older populations of the United States and contains a wealth of variables on a variety of topics. Hopefully this example analysis will be able to just give you some ideas about how to get started, and in particular dealing with the different kinds of data that the HRS is provided in, and talking a little bit about the HRS complex survey design and weighting. You can find out more about the HRS, Harmonized HRS, or our additional Harmonized HRS data sets like the Harmonized HRS end of life. And we also have a forthcoming Harmonized HRS HCAP, which is the Harmonized Cognitive Assessment Protocol. We just ask you to visit and register on the Gateway to Global Aging data at g2aging.org. We have a help desk that our whole team maintains. We have a team of people who work on these data products. You can email us at help@g2aging.org. The HRS also has their own help desk. That's HRS Help Desk. They have a great team working there, and they could provide you a lot of information about using the original HRS data, about their questionnaires, about their sampling, for instance. And the RAND HRS also has their own help desk if you have particular questions about the RAND HRS longitudinal file. As we mentioned earlier, the recording, slides, and Stata code used in this webinar will be available on the Gateway documentation page sometime tomorrow. And there you can also find many previous webinars that we've done. Maybe if you're interested in a different survey, we've recently had an introduction to Lassie, an introduction to well-being measures. Here's something about Charles, CLOSA, a methodological seminar about Lassie. And this is a great way to kind of get an idea of other topics that we didn't cover today. And then we also have a blog that we produce, which I'll just mention. So you can see here, we update this blog quite regularly with information on different topics. So I'd encourage you to just follow our blog as we post it. If you're subscribed, you can subscribe to our Twitter. Or if you're a user, you can also opt in for or not opt out of email alerts. We can give you more information about new data releases, webinars in the future, or new blog posts. So thank you everyone for joining, and thank you, Jenny, for co-hosting this webinar with me. I think Jenny and I are both happy to answer questions at this point. If anyone has any additional questions, you can present those now. And feel free, you can type them in the chat box or the question and answer box. Either is fine. And if there are no questions, if we've covered everything you could possibly know about HRS and the different data sets, then thank you. Yeah, thank you for participating. We had a great turnout for this webinar. And I really hope that it was quite helpful.